Nobody told me.
I've never done this before from the side. Share to group. 1, 2.
Daniel Bates. That's not for them.
Yes. To go back, that'd be great.
We will now call this meeting to order. Please stand for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Do I have to take roll call?
Director Sandra Hudson.
Here.
Thank you.
Okay, public comment. This is an opportunity for the citizens to speak on items not listed on the agenda that are of public interest and within the subject matter jurisdiction of the district. For the record, please state your name. The board has a policy of limiting any speaker to not more than 3 minutes. The board cannot take action on items not listed on the agenda, and board members will not enter into discussion with speakers, but may instead refer the matter to staff for report and recommendation at a future board of directors meeting. Public input may be offered on the agenda items when they come up for discussion and or action. Is there any public comment?
Who's that? Who's that?
Good evening, Elizabeth Bailey. Good evening, members of the board. Rosie, at the last meeting, you said that you don't believe you've done anything wrong as a board member that would warrant a recall. Let's be clear about how recall works in California. Under the California Elections Code 11,386, a recall does not require negligence or misconduct. You serve at the will of the voters. If the people lose confidence in your representation, they have the absolute right to recall you. Even if you have done nothing wrong, the voters can still decide you no longer represent their values. But here the situation is worse than that. The hospital is teetering on the edge of bankruptcy. The public has repeatedly raised concerns about meetings that we believe are not being conducted properly. Time and again, the public has asked this board not to move forward with certain decisions, and yet you have gone ahead and done exactly that, disregarding the will of the community you are sworn to serve. According to the official minutes of the June 25th, 2025 board meeting, page 16, during closed session item 9B, number 2, this board voted unanimously to appoint an infection control practitioner. The vote was taken by Directors Hudson, Brooks, Brown, and Bernica, with Director Sorghum absent. The appointment was awarded to Melody Bowen, who is the daughter of Director Rosie Rowell. Rosie failed to abstain from this vote, and her daughter received the contract. This is a direct conflict of interest under California Government Code 1090, which prohibits public officials from being financially interested in contracts they approve. In addition, Government Code 87100 under the Political Reform Act prohibits any public official from making, participating in, or attempting to influence a governmental decision in which they know they have a financial interest. The fact is, this hospital laid off 16 employees as a cost savings measure. At the same time, the clinic continues to operate without the public knowing basic facts, such as what is the average daily patient count at the clinic? How much has the clinic billed to date? What is the average bill per patient encountered? What is the average daily cost to operate the clinic? Until these questions are answered, the community cannot know if the clinic is serving its purpose or draining resources that the hospital cannot afford to lose. This hospital, in closing, this hospital belongs to the people of this district. The voters have every right to demand accountability, transparency, and to recall board members when trust has been broken. And Joanna, I'm going to give you this. It's an official public records request for said items.
Any more public comment?
Sorry. That's okay. Good evening, everyone. I would like to publicly respond to an ADA accommodation request that we received. I'm sorry. Thank you. The district is currently seeking proposal from various IT vendors that provide several of the services referenced in the correspondence that we received. These proposals will be presented to the board at a future meeting. Pursuant to the ADA, the board will review the proposals to determine their financial feasibility before making any determinations regarding their implementation. In efforts to promote transparency, a YouTube channel has been created and will be used to upload videos, recordings of board meetings. This initiative is also intended to accommodate individuals requiring accessibility and other accommodations, ensuring convenience accessible to the meetings. I would also like to notify everybody that we're going to provide these flyers in the back of the room. I'm not sure if there's a copy back there, but if not, I will also upload this to the website tomorrow. It gets you on the website of the PBH YouTube page where the recordings will be uploaded. Thank you.
Good. Good. Public comment?
Mine starts with Ms. Naya. I looked up the definition of chief executive officer. The CEOs are to maintain executive accountability for the hospital's overall operations, strategic direction, and financial stability. But what stood out to me was the financial stability. Have you taken steps to ensure this hospital's well-being? Have you made any effort to protect it based on your own comments? This issue started in 2020 during the COVID. Yet during these difficult years, you constructed a clinic and exceeded its budget by $1.5 million. Is that how you manage the financial well-being of this hospital? In 2023, you guys borrowed $8.5 million without making any repayments, expecting that it would be forgiven. When you awarded a $30,000 bonus to your chief nursing officer, that's not putting the financial health of the hospital in first. You depended on your line of credit from Provident Bank each month to meet financial obligations. Is that a responsible financial management? We requested financial statements and reports for months, but the requests have been repeatedly ignored and delayed. Various organizations have offered to help you, but have turned them away. This is not caring for the hospital's financial health. The final straw for me was during the last meeting when it wasn't even deemed important enough for you personally to show up, nor your CNO/coup to attend while a vote regarding potential filing for the Chapter 9 occurred. Is this your approach to managing a hospital and maintaining its financial health? Absolutely not. Yet you still have the nerve to draw a salary for a position you have not fulfilled. If I understand your salary correctly, it's for a facility for 25 beds. BAR certainly does not accommodate 25 beds. Perhaps you should refund the hospital some funds, if only for the sake of its financial health. Blame anyone you want, the CFO, the coup, the Provident Bank, the ultimate responsibility lies on you. I believe the COVID crisis netted the hospital some $6 million, and you stated it had to be paid back. So where is it gone? It was a grant and did not have to be paid back. Add the money up since 2020, $6 million for that, 8.5 plus, and all the money coming in, and you're still $12 million in the hole. And you're begging for financial help. You've not upheld the financial health of this hospital. You are the one deserving of criticism and contempt. While those shortcomings are yours, it certainly does not relieve the board of directors, Pamela, Rosie, or Trina, of their responsibilities. All of you have taken in everything this attorney has told you without question, and this board does need to be recalled.
Any more public comment?
Hi there, my name is Joshua Coleman. So I've got a couple questions, and I don't really need you to answer them, but they will be important in the context of this task, for this speech. Who is the board formally authorized to prepare agendas for meetings? And I asked for a full list of names at some point in time, because according to your bylaws, it's supposed to be just a secretary. Are any of you familiar with what metadata is? It's okay if you don't, but you're gonna find out. So background of violations. Under the Brown Act, authority to prepare agendas can only come from the legislative body itself in the meeting, not from individual members, staff, or consultants. The authority cannot be delegated informally. Yet, metadata analysis of your agendas has shown repeated violations. Some agendas were created or modified after legal posting deadlines, sometimes even the same day of the meeting, or even months after the fact. Most concerning, metadata shows that agendas were prepared or altered not by district staff, but by outside parties, including Attorney Gina Whitty, Consultant Attorney Kevin Croker, Consultants Vivian P., Bob Mara, and even the state DHCS employee Vanessa Burke. Despite this, every agenda still carries the official signature of the district's board clerk, Joanna Gonzalez. This raises an obvious question. How does the signature of someone appear on a document created or altered by someone else? Sometimes even after the meeting already took place, because that's definitely in the media. When her signature remains and alterations are made, it implies that she has vouched for the authenticity of the document that was no longer heard and certified. This has serious implications for record integrity and public trust. So now we get to what metadata is. Metadata is data about data, and a PDF that records when the document was created, when it was last modified, by whom, and by whom, I'm sorry. The information cannot be erased by simply copying or downloading the file. In these agendas, metadata shows the actual timeline and preparation and alteration. The timeline does not match the statutory requirements. The Premier Healthcare Contract. The board's handling of the Premier Healthcare Contract shows another violation. The item was placed in closed session under the claim of confidentiality. The Brown Act allows closed sessions for only narrow purposes such as litigation, real estate negotiations, or certain personnel issues. A contract renewal with a vendor does not qualify. Withholding the item from the public discussion unlawfully deprived the community of its right to transparency. This was an illegal closed session and an improper withholding of information. When he fought the issue in the July 30th meeting, Dr. Zalotti was right. This is not a discussion that needs to be behind closed doors. Legal significance. The Brown Act requires agendas for regular meetings to be posted 72 hours in advance and 24 hours for special meetings. When agendas are created late, changed after posting, or altered by people not authorized by the board, the meetings run off. The Brown Act also makes it a crime for members to knowingly participate in the meeting or take action when they understand the agenda is defective or illegal. If board members proceed with business on an agenda that they knew was questionable, That constitutes not only violation, but. No.
Is there any more public comment?
Anybody want to take this, my, speech? Yeah, right there.
Great. Hi, my name's Sarah Payne. I live at 850 Oasis Village Court, White, California. I'm going to go ahead and finish off where you left impacts. Board members are left unprepared agendas they review or later alter. The public is misled into thinking an agenda is final when it is not. Trust is governance erodes because officials report records appear compromised. The misuse of closed sessions from premier contract deprive the community of oversight. Actions taken under knowingly defective agendas risk criminal liability for participating board members. The Brown Act exists to guarantee openness and fairness. Metadata and board actions show the district has not met that standard. These concerns demand accountability both to protect the board members themselves and to protect the public's right to lawful, transparent governance. Because the legal, financial, and political skills stem in large part from the advice and involvement of Attorney Lena Wade, I urge the board to terminate her contract, continued and reliance on counsel whose actions and guidance expose the district to violations of law only compounds the damage. Let me read that one.
Well, it also mentioned that this meeting, the metadata showed that this meeting is a violation.
Okay, you stated that this meeting also shows that in the metadata it's also a violation of law.
Any more public comment?
Hi, I'm Joanne Sparrow, and I just wanted to address the first person's speech, to let them know that, Rosie did not attend the meeting to vote on her daughter's, position being changed to infectious disease. She actually recused herself. So I just wanted that on the record. Thank you.
Any more public comment?
My name is Mark Vaughn, and I'm just here to support Rosie because I've known her for 30 plus years. And she's always been a good person, and she doesn't need to help her daughter out or herself. I just want to make sure that everybody can see her in the light that I see, because I've known her for that long. I don't have too much to add other than that, but I do want to keep the clinic open because I think it serves the community in the best way possible. I don't know the inside, what goes on the inside, but I know when you go there, you feel like you can trust the staff, and the staff is very supportive. So, that's all I got.
Amen.
Any more public comment?
Now, when it comes to a recall, who pays for that?
I think we do.
And we've already blown enough money that our hospital is broke. So I don't see the point in recalling the board. There's a member that wasn't elected. Was everybody elected on this board? Who wasn't elected?
No.
None of you? So how do you recall something that wasn't elected? I don't know how anything happens in this community.
Any more public comment?
Ma'am, can I get your full name?
Kathy Linares.
Thank you.
Hello, my name is Samantha Doyle, and I just want to say, I don't know all the ins and outs when it comes to exactly how the hospital operates, but I will say that people here in front of me have been tremendous help in the community. Each one of you guys have put yourself out there for the city of life, and I know that having a hospital and having care has been a big help to us. My biggest fear is knowing that what will happen if the hospital and the clinic falls apart. Where would the life go? I will say that I was in the hospital when I first came because I'm not originally from Northern Virginia. I've been in Baltimore for 5 years. When I first got here, I was like, I don't know. Hospital was like, maybe not. But then I tell you what, the hospital saved my mother's life. And it really changed the view of everything how I felt towards the hospital. And if I didn't have the hospital, I probably wouldn't be here still to this day to continue to help out with the community. I'm a clinical therapist, so I help with mental health. Every day I get up, I come out here and see what can we do to better this community. And all this pointing of fingers and who did what and what's right or what's wrong, at the end of the day, what can we do to move forward? From this, I understand we had a lot of mistakes, we had a lot of mess ups, but right here today, what can we do moving forward? How can we keep this open? Because if this shuts down, where are we going to go? There are people out there that cannot make it 45 minutes. There are people out there that don't have the family support or friend support. They're by themselves. So I want to look at the bigger picture. When we leave this space today, what steps can we make to move together? Instead of fighting one another, instead of creating these bridges, these gaps, how can we come together and make that change for the Black community? Because we need everybody. This is a teamwork here. It's not something that you can do alone. And we all have to come together for that to happen. So that's all I want to say. Now have a good one. Any more public comment?
Hello, I don't know that I'm gonna need the microphone, and I wasn't prepared for anything tonight, but my grandmother invited me to come here, and I just wanted to say, my name's Melissa Woodruff. I'm a special education teacher. I'm going on my 4th year. I just started my master's degree to be a school psychologist here in our district, and my whole driving factor for that was to better our community. I moved my fiance here from Southern California on the hope that Life California was going to be where we spend our whole lives to be closer to family. I have a sister in Phoenix who's pregnant right now, who's waiting to have her baby to return to life because she doesn't feel safe having it in the hospital. And the fact that we come here to better our community and to be with our families, but we don't have the faith or trust in our healthcare is really scary. And when it comes to grandparents and wanting to be here for them, I have grandparents that can't make it to a hospital if something happens and it scares them. And like the previous speaker said, I don't think that we need to be fighting with one another, but I think that you have concerned community members, and we need to have a concerned staff, and we need to have a concerned board, and we need to put the financial matters aside and think smart and not selfish, and come together to be better so you have people that want to stay here, because if we don't have a healthcare system, we're not going to have anybody here that's going to want to build the community, and we're going to fall apart as a whole. And that is all.
Any more public comment? So if there's no more public comment? Oh. Yes.
Well, I've been trying, since already, I've been trying to find the minutes of August, July 30th, even though on the agenda it says it's item number 11, 7, action item 7A11. It says minutes from 7/30/2025. It's not on the agenda package that was provided to me. So I don't know if it was provided to anybody else or not. And that should help you see whether or not Rosie voted or didn't vote. But I'll start by saying that I echo the last speaker. I think this hospital is essential to this community. I've been a physician, a surgeon at this hospital for the last 27 years. And I've always had friends and foes on it. I told them all the time one thing. The job of this board is not to practice medicine, is not to be forensic accountant, but the job of this board to make sure that the financial stats of this hospital is solid. They make sure that you have the money. And if things go south, as Sandy had said, it's going south since COVID. But what was your plan since COVID? That's 5 years ago. It's not whether or not you point finger. I know Carmela and almost all of her family. I can't say they're friends. I know Rosie and her daughters. I know Dr. Bruce. I know Sandy Hudson. And I know Trina. We worked together for years. But it's not a matter of whether or not it's a job that you feel somebody patting you in the back and you feel like I have a power to be on the board. You know, if you guys can't handle it and the hospital is going down, going to bankruptcy, why not resign? But randomly, pick somebody else, pick somebody randomly, put them on, but maybe they have a better idea. It's not whether or not you put my friends foot forward. If somebody can do it, you know, we used to have Peter Bloom here, I know most of you knew that. When things went down and the hospital was losing money, look, they multiple meeting, he brought his friend, and they all said, oh, he's doing a great job. Well, as that lady said, the hospital finances is very complex. Not everybody knows that. But you guys need to listen to the community, you need to do things right. You know, I have to make a correction last meeting. I said I haven't been paid by the hospital for 3, 4, 5 months, but they issued me two $10,000 check. So they still owe me over $100,000. They haven't paid me for 3 months, but they do that. And, you know, we ask a simple question. The community deserves to have an answer, okay? Dr. Brooks, did you donate $20,000 to the hospital foundation? A few years back?
At one time, 20
Good. Okay. Why is that Dr. Bush can answer that question, but if I ask Rosie something, she won't answer?
Any more public comment?
Hi, I'm Heather Lucha. I don't know you two, Dr. Brooks has been a pillar in the community for as long as I can remember. I love you. Trina I had a son here that was sick. He had cancer and he passed away. She was there every second. Sandy Hudson, like a second mother to me. I haven't lived here in a long time. I recently moved back, so I'm not really sure what happened here, but the healthcare system is not just a normal job. You have people's lives in your hands. And this community, my family has lived here for years and it's dying. And if we lose our hospital, the town's gonna die. I have kids that go to school here. I mean, we all have kids here, whether we have kids or not, because in this community, all of your kids are my kids. You know, like, what happens to the next Riley that's sick and can't go to the hospital? What happens to the next grandma that's having a stroke and can't go there? And if you don't care about anybody else, the river. We can't have recreational things here without a hospital. They're trying to bring the rodeo here, the car races, all the stuff they're trying to do to build our community. We literally cannot have it without a hospital. So even though Rosie and Carmela, I don't know you two, you don't come into a job like this without a good heart and wanting to do something good for your community. Being in the healthcare industry is not easy. It's hard, it's sad, it takes a toll on you. So I'm just, from looking from the outside in, I'm not really sure why we have a pin. Don't know how that happened. I don't know why we have a lawyer here. I can't even afford to have a lawyer fill out paperwork for me. God knows how much we're paying for that. You have a policeman here. I've been to so many meetings in other towns that a policeman has to be here. It's just sad because this community loves each other. And I come to these meetings trying to figure out what's going on, and people stand here and they ask you questions. But the main one is, how can I help? And nobody answers any questions. So I don't know how these meetings work. Maybe you're not allowed to, maybe you just don't answer questions, but you have a whole community that wants to help. Maybe they'll volunteer. This has been going on for so long, but people are asking. So I don't know what else to say. Just whatever you can do or can't do or have somebody else do, you know, we're losing our community.
Any more public comment?
Well, my name is Adriana Figueroa, and I was born and raised here, but I've lived in the city for most of my adult life. I feel like it is basic knowledge that things need to change. So, what my question is what are the things that you guys are going to implement? Dr. Brooks, you're an amazing person. Carmela Garnica has been running a successful business for decades, preschool teacher. I don't know you, Rosie, but I am confident that with the right staff and determination, hard work, and support, that if you are given enough time, you can succeed with Carmela being a lead. She hasn't failed yet. So, what are the positive things that you guys have planned? We know all the bad stuff. What's the good stuff, though? So, no public comment.
Good evening, everybody. My name is Elizabeth Rojas. I just want to come up here. I was not planning to, but I want to thank Dr. Brooks for all of your hard work. I was one of your patients, for many years before you stepped down. Carmela, I want to thank you from the bottom of my heart for everything that you do for the community. Keep going strong. I know there's a lot going on right now, but hopefully things get better, and because we need our hospital. I'm health-wise, I've been always sick. I visit the hospital a lot. I want to thank Trina. She's not here, but I had a very bad experience one day at the hospital. She stepped in, and basically they were, anyway, she took care of me. We need the clinic. I see specialists out of town, but my go-to is with Dr. Sylvia. She's amazing, and we need it for our kids. I have a granddaughter that gets sick a lot. Needs breathing treatment, things that So I just hope that we all come together as a community and find a solution instead of pickering at each other. And I think it's just time that we act like adults and move forward with everybody coming as one, because that's what we need for our community to keep our hospital here. Thank you.
Any more public comment? Since there is no more public comment is now closed. Now we have board comment. Dr. Brooks, is there anything you'd like to say?
No.
Ms. Hudson, is there anything you'd like to say?
There is something I'd like to say, Carmela. Can you hear me clearly?
Yes.
Can the public hear?
Yes.
The community has a right to know how its hospital is being managed and whether proper checks and balances are in place. Unfortunately, at Palo Verde, that system of accountability has been undermined. The attorney for the district, Lena Wade, has assumed a level of control that goes beyond the proper role of legal counsel. As a board member, I have a fiduciary responsibility to oversee the hospital and its operations, as do the other board members. Yet even basic requests are filtered through the attorney. For example, when I requested the patient census from the clinic, the employees could not provide the information until Ms. Wade granted her approval and gave the directive. This is not how public healthcare districts should work. The attorney's role is to advise the board, not to control access to information or to direct the daily flow of operations. Even more troubling is the growing concern that Ms. Wade is using her position not to protect the district, but to generate profits to her law firm. This creates a direct conflict with the community's best interest and further undermines public trust. Equally troubling is the lack of action by the board chair who has failed to address or correct this imbalance. The public must be made aware that the hospital is not being run with proper oversight and corrective action is urgently needed. I think we're all in firm agreement that we need to work together, but that means you have to be transparent and share the information and not run every option through the attorney who's charging for this every single time. It is not appropriate. Thank you for your time, and I'm glad to see all of you there.
Okay, next, Ms. Rao?
I have a comment, yeah. The last time we were together, Dr. Salobi made comments about my daughter. I want you all to know, I have a daughter, she's an RN. She has worked at this hospital for 25 years or more. She has been an RN on the med-surg floor. When the hospital got to the point where we needed to reduce costs, the med-surg floor was closed. Okay, all of the nurses on med-surg were either, two of them I think were resigned and went on to greener pastures. The others were given other departments to work in. One of the departments that was open, because the person who was in that department resigned and moved out of state, was the infection control nurse. Management, without my encouragement, my even knowledge, went to my daughter and said, would you like to take over that department? She said yes. It came to the board because I don't know why, but it came to the board for approval. During that vote, I recused myself. All right? I did not vote. Okay. While all of this commotion was going on last time, somebody made a mention that she was getting $140,000 a year. Wrong. That position doesn't even pay $140,000 a year. That position pays the same rate that any nurse in the hospital gets. My daughter is making the same amount of money in this position that she was making for 25 years in the med-surg department. I think we have to be really careful what we say. People get hurt. My daughter was hurt when she heard what Dr. Salobi said. And they have known each other for 20 years and have worked hard together. He used to respect her, and she used to respect him. I would appreciate people understanding that before they say something, they need to verify it and make sure that they're telling the truth. That's all I have to say.
Well, I do have a board comment. First, I'd like to say that I was publicly appointed as a board member for the Palo Verde Healthcare District for the last 10 years because no concerned citizen applied. My term will be over in approximately 12 months. In February 2023, the organization, a 501c3 since 1972, and where I am employed, was granted $67,500 for COVID-19 work. The Palo Verde Hospital District submitted the grant application to the California Department of Public Health. 10% of that grant was for the Palo Verde Hospital District Administration, and the 90% was for the chosen nonprofit. The California Department of Public Health chose the nonprofit organization I work for. Other applicants, such as the Black Rotary and the Chamber of Commerce, among others, did not qualify for compliance. The project period was short-lived and closed within weeks by the California Department of Public Health. In October of 2023, a co-board member, Sandra Hudson, filed a conflict of interest complaint against me, and therefore I was investigated, and all the paper trail was submitted, including my Form 700. Mrs. Hudson's complaint was rejected by the Fair Political Practices Commission in November of 2023, which she had knowledge of. I have personally handed out the rejection notices to the public twice at different board meetings. In November of 2024, I was elected board president when Ms. Hudson resigned for the second time. In January 2025, the Palo Verde Hospital District was cyber attacked. Palo Verde Hospital District operations suffered. Cash flow slowed. Instead of walking away like others who resigned and return, resign and then again return, I have committed my time and resources to strengthening both the nonprofit I work for, the Palo Verde Hospital, along with Palo Verde Hospital Clinic, which serves so many in our community. Being an advocate for our community during times of crisis, like during COVID-19 pandemic, I spearheaded a campaign to ensure our community people had the resources and the support they needed through the grant from HRSA, Health Resources and Service Administration, and through a grant from the Office of Community Partnership and Strategic Communication of the state, to a total tune of $500,000. Through these efforts, youth were employed to secure opportunities, through summer work experience programs, and to low-income families through food drives and other family child care that provided relief where it was needed most. The final grant approved most recently was a $2.5 million from First Five in order to provide subsidized child care for the community parents while they work and hire people to work. In the past, during the hot summer temperatures, through a grant, we had food centers for 15 years, supported by the Southern California Edison to protect vulnerable residents from the dangers of extreme heat. We played games and provided snacks and drinks. Many were homeless who needed it the most. I have provided space for those self-help programs such as the Alcoholic Anonymous, the AA, the Narcotics Anonymous, the AA, the Domestic Sexual and Teen Dating Abuse Advocacy, among others, and have invested time advocating for children and adults with disabilities through special education rights and other services. I have committed myself to provide employment opportunities for many people by giving them a pathway towards stability and independence by employing 40 women, 50% farm worker women. We must remember that turning around years of Medicaid, Medicare, and legislation changes did not happen overnight. Progress and adjustment through these rural health initiatives and changing demographics take time, patience, dedication, and support. My record has proven with a history of providing services to families, creating opportunities, and ensuring vital programs remain available in life. I am committed to the well-being of our community, and I have proven it since 1979. Bringing up the complaint over and over and over by Ms. Hudson that was rejected by the FPPC in November of 2023 is like beating a dead horse. Instead, channel that energy in creating solutions of what we have presently at hand and come together in unity and support the people of the hospital clinic program. Now is the time for us as a community to stand together. Let us do our job and focus on moving forward together with unity, faith, and patience, so we can continue the work of keeping the hospital and the clinic's doors open for the people that we serve. Thank you very much.
Can you hear me?
Okay, next item, approval of the agenda. Is there a motion to approve the agenda?
I'd like to
Do you have a second?
Madam President, may I be recognized?
Yes.
At this moment, I'd like to request that we table minutes for July 10th, July 16th, and July 30th to allow staff time to fully review and prepare them and provide a final draft. Just to reiterate, it would be July 10th, July 16th, and July 30th.
I'd like to make an added comment here regarding Dr. Sonobi. I'm responding to your letter, that was received by the board on August 8, 2025, regarding the Premier Healthcare Partners Agreement. I understand that although there was a confidentiality provision in the agreement, Dr. Carrillo agreed to publish the agreement. Therefore, a copy of the agreement has been provided to you and posted on the district's website. According to your letter, you indicated that it is agreement. You're interfering with the public. According to your letter, it indicated the present that you would like to. Yes.
Yes, I believe that you are completing your board comments.
Yes. Yes.
Thank you for attending.
According to the letter, you indicated that if the agreement is an exclusive agreement, that you would like to present it to the NEC prior to board discussion. Please let me know as soon as possible when you will be presenting this agreement to the NEC so that we can move forward accordingly. Okay. Now I'm sorry. Now we can go back to item 4. The approval of agenda. Dr. Brooks had made a motion. Rosie had seconded. Joanna, can you call for the question?
May I restate, Madam President?
Yes.
We are approving the agenda while tabling minutes for July 10th, July 16th, and July 30th. Vice President Roa. Aye. Director Sargent is absent. Director Brooks.
Aye.
Director Hudson.
Aye.
President Garnica.
Aye. Okay, there is a presentation on ongoing transparency practices by Mrs. Zelaya, Joanna Gonzalez, and Nina Wade.
Madam President, may I have permission to present more outstanding? I would like to go ahead and address and be able to face the board as well as the public.
Yes.
Thank you. Good evening, everyone. This evening, we have prepared a presentation that outlines the ongoing transparency practices. And I do apologize for the lack of eye contact, and I'm going to be reading just so I can stay on track. So, Jason, thank you.
Perfect.
That's a bit, that's fine.
Actually, no.
Thank you.
There you are.
Thank you. And our representatives and Ms. Hudson see this as well?
Yes.
Thank you. So we can move on to slide 2. Since assuming the role of clerk for the board in October 2024, I have dedicated my efforts to understanding the Brown Act, its application to the board of directors, and my responsibility in ensuring compliance. As you can see here, agendas must be posted 72 hours before regular board meetings 24 hours before special meetings, and a reasonable time, less than 24 hours before emergency meetings. We'll move on to the next slide, please. Since November 2024, the district staff has been including staff reports with the agenda packet. Although this does add additional time required to prepare the packet, we believe it is a necessary step as it provides context for the matter considered. We try to include history of the matter, a summary of the issue, and action staff is recommending. Also, we include the documents that are to be considered if they are prepared at the time of posting. If the documents are circulated to the board members after posting, but before the meeting, the documents will be sent to all individuals who have requested copies of the agenda and made available to the district's website at the same time. Documents are also available for review at the district. For documents distributed at the meeting, those documents will be also available to the public at the meeting. If a third party passes documents out at the meeting, those documents will be posted to the website and available to the district for review after the meeting. Move on to the next slide. Thank you. So for this slide, we have some safe harbor language. The Brown Act does provide safe harbor language for the various types of municipal closed sessions. Substantial compliance with the safe harbor language is recommended to protect legislative bodies and elected officials from legal challenges. If a matter is not listed in Brown Act as an appropriate subject for a closed session, the matter must be discussed in public, even if the subject is sensitive, embarrassing, or controversial. In November 2024, we compiled a list of what Brown Act calls safe harbor closed session description for items that may be discussed in closed session. In addition to the Brown Act, there are also permissible closed session topics included in the California Healthcare District Law and the Civil Code. This is how anticipated litigation, existing litigation, and potential litigation should be agendized for closed session according to the Brown Act. And these are the examples. Next slide, please. If there will be real property negotiations, we are required to identify the property, identify the negotiating parties, and describe the terms under negotiation. And here you will see examples. Next slide, please. If a person submits a claim against the district but has not yet filed a claim in court, it is agendized as a liability claim. If there is a threat to the public service or facilities, this is how it should be agendized. For employee matters that may be discussed by the board, these are the reasons the board may discuss these matters in closed session: appointment, performance evaluation, or discipline dismissal. The title of the employee the title of the employee and not their name may be disclosed. And again, these are examples. These are the proper closed session descriptions for medical staff credentialing and peer review and medical audit and quality assurance reports. Even more examples. Lastly, go to slide 10. For trade secrets, we include the name of the party with whom the district is entering into an agreement. As you can see, this is another example. That concludes my presentation. Thank you so much for your attention. I will go ahead and pass the time over to Lena Wade.
Thank you. So if you'll go on to the next slide, and again. So this is a current, or today's agenda. And as you'll see, Joanna's worked very hard to keep it similar to the way it existed before November. You can go on to the next slide. And the next. And so she includes what's to be considered by the board of description as required by the Brown Act, but also included in the packet, you will always find the staff report. It actually says it gives a history, little summary of what's before you and the recommended action. In the next slide. And then the closed session items will be agendized as she has set forth in those safe harbor descriptions. And then I want to show you how they were done before. So next slide. So this is on your portal. This is from January 24, 2024. So there are no staff reports. Some of these contracts that are mentioned are not included. And then if you'll go, let's look at closed sessions. I believe it's, keep going, right here. So you'll see under closed session, it says radiology. Now there's not a Brown Act provision that allows for radiology to be discussed. Then you'll see it says personnel matters. It doesn't say the title, whether it's appointment, discipline, or evaluation. So there's not enough information there for the public to see, to know what you're doing, and also to let you all know what is before you. So go on to the next one. This is January 31st. Again, most of these agreements were not included. Go to the closed session. And then you'll see it says personnel matters. Again, we don't know what that means. Then it says report involving trade secret. Okay, so that's similar to the Premier Health, right? But here it says discussion will concern a service. So we don't know what that means. We don't know who that's about. So now Joanna includes the name of the party that would be the subject of that matter. The next agenda is February 14. Let's go to closed session. You'll see here again, personnel matters. We don't know what that means. And report involving trade secret. Discussion will concern a service. We don't know what that means. The public doesn't know what that means. We don't know if it's properly in closed session. The next one is February 28th. Go to closed session, please. Right there. Personnel matters again. It says legal review of budgetary issues and proposal. The budget is not permitted to be in closed session. So what Joanna and Michael Rose have done is they've looked at all of these agendas and tried to pull that information regarding the budget and made that publicly available. Because that was not, it's not permitted under the Brown Act or the Healthcare District Law or the Civil Code. Also, you'll see it says again, report involving trade secret, discussion concerning a service, the public nor the board knows what that means. The next one is April 3rd for closed session. It says attorney comments about agreements for legal, IT, and project management services. That is not an appropriate Brown Act description. We don't know what agreements these are. We don't know why they are in closed session. It's very limited as to what the attorney can discuss with you, it's regarding litigation or what have you. That's how that's set up. But there isn't one like this. We don't know who's involved. The next is March 14. Go down to closed session. Personnel matters, business matters related to an IT service. Don't know what that means and don't know if it's properly in closed session. Star Medical Associates IPA agreement. Do not know why that's in closed session. There's no reason given. Rose Business Solutions Accounting Controller. Now he came on as a controller, I believe, at that time. So it should have been, personnel matter involved, and then put his role, and whether it's appointment or what have you. If they were considering the contract, that could never be in closed session because it involves salary money. That would be properly in open session, but we don't know. Okay, the next one. This is April 9th of last year. Closed session, business matters related to an IT service. There's not a closed session item for that. The next is April 24. Business matters related to an IT service. Don't know if that was proper. Don't know what the IT service was and how that could be in closed session. Legal report, that doesn't say anything to the public or to you. Don't know what that is. The next one is June 26, closed session. Here it says legal report. Don't know why what that is. Finance-related matters, again, cannot speak about finance-related matters as it's presented here. You need to have a closed session description that's appropriate. Radiology services, don't know why that is listed here. The next one is July 24, legal report. Contracts outsourcing review, don't know why that's in closed session. Finance-related matters, again, we did pull those out, and Joanna and Michael have done that. The next is July 10, legal report, don't know what that is. Finance-related matters, again, those have been pulled out. Radiology services, do not know why that's in closed session. And then we have October 3rd, legal report, personnel matters, again, don't know what that is. Finance-related matters, revenue cycle with GEDS, don't know why that's in closed session, that would be an open session matter unless there was some trade secret or something that you would have to say that. And the last one is May 22nd, I believe. Or maybe we already did that one. It's out of order. Yeah, so this one says outsourcing review. I'm not sure what that is and why that would be closed session. Business matters related to IT service, finance related matters, financial consultant agreement, that would be open. So anyway, your staff has worked very hard to improve on the agenda and to make sure that there's more information available to your public and to you, particularly by including those staff reports. And we hope you find those informative. So thank you.
Thank you very much, Nina, for that presentation, and Joanna for that also is. That's enlightening because last year when we were having these meetings, not one peep squeak out of all that stuff that was going on. Now that we're going according to what the Brown Act is, we have an attorney that's her forte, carrying us over to this. Now all of a sudden there's all kinds of people complaining. But last year, not a fly came in here. Only us were here and our group here. So I'm really grateful that you are able to do that, Nina. It's we're very appreciative of that for keeping us abreast of this information. So moving on, are there any questions from the board regarding how it was presented? Dr. Brooks? Ms. Hudson?
Yes, I'm going to back up just a little bit to your prior statement where you said that your case had been cleared by the FPPC. That is not correct. You and I are both well aware that what they said was they wanted more information. At that point, Elizabeth Bailey filed the same complaint with more information, and it is still under investigation. And the question I would have for you, Carmela, is did you meet the terms of that grant? And how so?
So do we have any public comment? On the presentation that was presented?
Thank you, Joanna. You put up some slide. Is there anywhere in Brown Act that states that the board can discuss any item that's not on the agenda? Can they do that?
It's your public comment, Dr.
First, but do you know? You don't know.
We can talk after you go.
Okay. Well, I'll tell you, if you're learning it, I've done it for 27 years. You cannot make any talk or any comment if it's not the agenda. And the problem I have is you're wasting this community's money, you're taking the hospital down, and you're putting the money in a firm's pocket to the tune of $40,000, $50,000 a month when you get bullshit advice and you don't even get it. Dr. Brooks made a motion to approve the agenda. Rosie seconded it. There was a discussion. You were ready to vote. You had long passed the board comment. The board comment was the item before that. The board comment was item number 3, and now you're on item number 4. And Carmela, you read a letter that I was going to say it anyways during the MEC because we have it for you. You wrote a letter today at 4:30 and sent it to me. So it was after the agenda posted. It wasn't before the agenda. But you violated the Brown Act. And rather than say Dr. Soul is my friend, maybe I shouldn't talk about this. Maybe I should talk about it some other time. You insisted on violating Brown Act and doing it. And then the board attorney lied to you. She said, oh, Carmela, this is your board comment, correct? And you said, yes, it is. Well, you both lied. There was no board comment at that time. The board comment was closed. You did not let Miss Anaya speak after she made her comment. She wanted to talk, you didn't let her. But you followed the board attorney's mistake. That's incompetent attorney who in a public meeting, she can be reported to the Bar Association and say, you lied. You know that this was not a board comment. This was clearly agenda. Somebody made a motion, Dr. Brooks. Somebody seconded it. The only thing you can talk is agenda. You can't talk about anything else. So you violated Brown Act. Why is it important? The important is so you don't run the board like it's your own business, your own 501c. You know, Rosie mentioned that, oh, I wrote the check to Escuela, and I didn't send it to Rosie to come out. But the money went to you. You bought the band. You enjoy the money. I mean, this is why Brown Act is important. This is not Brown Act so that you have a problem. You make comment, well, why everybody's complaining about Brown Act? Because you didn't violate Brown Act 2 years ago. And if you violated Brown Act 2 years ago, sitting on the board, and you didn't say anything, then you have another problem.
Okay, time's up. Any more? Yes.
I would like to publicly thank our IT department because they are the ones that created our PBH YouTube channel. And I wanted to give them credit for the amazing work that they have done.
Okay, we will now have item 6, reports, an update on operations and finances of the district. You have to say on. So, good evening and thank you. Good evening and thank you for all for joining us. As a brief update this evening, I want everyone to know that we are actively pursuing outside funding and taking aggressive steps to collect all outstanding accounts receivable. We still await a response to our formal request for emergency and financial assistance from the state while we explore other outside funding opportunities. One of the new opportunities is funding through a program earmarked in the One Big Beautiful Bill Act through the newly created Rural Health Transformation Program. The funding is intended to provide immediate relief to rural hospitals while enabling facilities to establish the necessary tools for long-term success. That's exactly what we need, so we are pursuing it. Meanwhile, we continue with the intensive work necessary to reduce expenses and keep them as low as possible. We are making progress in all areas, but we have more hard work ahead to be in the position to offer the full scope of essential care that this hospital and our community clinic provide. I appreciate your presence, input, and continued support as we are doing everything we can to turn things around. Is there any questions from the board? Ms. Hudson, is there any questions?
Not at this moment.
Any public comment?
My name is Nico. The only question I have about this financial thing is, how much are you guys losing a month right now? Are you still staying above water? Are you below water? Are you treading water? Are you still losing to around $200,000 a month? Are you losing $1 million a month? I don't know. You haven't told us that. And it's nice to have this transparency, but it would be nice to have the numbers list so we can see what you're talking about. Because at this point, we're guessing where you stand financially. And this is the biggest problem we have with all of you, is you don't give us answers. You don't give us paper so we can read this stuff, so we can see these numbers. It's easy for Michael to throw numbers out. He's the CFO. We can do all the numbers he wants. But if I don't see it on paper, I don't believe it. And you shouldn't either. As a board and as a director of the hospital and CEO over here, She should demand a financial report every month for every meeting. You shouldn't just meet on saying, oh, we've got this, we've got that, we might have this, we might not have that. That's what is so discouraging about all of this is, you don't seem to take it as serious as you should. And if you want the public to be on your side and fight for you instead of against you, you'll start giving us financial statements. And you'll show us where the money comes in and where it goes out. Any more public comment?
Yes, on the financial side, thank you, Dee, for making that comment, and I will follow that to say that I got to a major disagreement with you guys 2 years ago when you wanted to close the OB department. I didn't want the OB department to be closed, but you guys said, in order to save the hospital, we have to close the OB to save money. I said, okay. When any other, they said, no, I trust Ms. Anaya, she had her analysis, and they said, we have to close the OB. So you guys close the OB. Have you had anywhere, any study, Dr. Brooks, have you seen any number that shows closing the OB, how much money saved the hospital? Have you seen one? No. You're a board member. Sandy, have you seen one, Ms. Anaya? Sandy Hudson, have you seen any study that shows how much money the hospital saved by closing the OB?
I have not.
Okay. Well, if you don't know whether or not closing the OB would save money or lose money, how did you vote? How did you guys agree in that closed session? You know, we go through all this bullshit of putting these minutes up here from 2024. How much money do you think this attorney charged to go through all that minutes? She spent thousands of dollars. It's your money. It's your money, clapping guys. You can clap all you want for me or against me, for common law or against common law. It's the attorney who makes the money. She made thousands of dollars. I promise you it's not less than $10,000. Okay? To go through all that minutes. Why? Why this didn't come 2 months ago? Only because she knows. She knows she violated the Brown Act by putting premier contract, the contract that has been done before in open session, she put in closed session. And I tell you why soon. It was to hide the numbers. They didn't want this public to know how many of you made $4,800 every 24 hours. How many of you? Raise your hand. How many of you made $7,800 every day? How many of you? Raise your hand. But that's in the contract. We don't want the public to know how you're spending the money. That's like Dr. Bush said it to me multiple times, like a drunken sailor. So she makes all that money. She makes all that money to put all those minutes up there to act like this. She's the one who leads you by the leash to the wrong bottle nose, put you in wrong road and say, yeah, it was my comment during board comment. Well, it's recorded. Everybody knows you passed the board comment. Why would you follow her lead and say, yeah, it's board comment? No, it's not. You were a motion, a second, you're waiting for the vote. For agenda, and you go, this is all making money for the attorney, and then you think you're doing good job on hospital finances? You know, you can laugh all you want, Carmela, but this is the OB that closed, we suffer. It's going to be the hospital that closes, we suffer. You have plenty of money, you'll go elsewhere.
Okay. Any more public comment? Okay, that's it. Okay, we'll now close public comment. Are there any comments from the board? Ms. Hudson, any comment?
No, at this time.
Okay, moving on along to item C, Medical Executive Committee report. Dr. Salobi.
You missed item B.
Item what?
Ms. Lena, could you hold her hand and tell her item B?
Item what? Oh, CEO report.
Just a CEO.
It's all right. So, see if this is on. Okay, as for licensing and accreditation, we had a anonymous complaint
made to the CDHP. They came out on a visit. We're not expecting any adverse findings from that, but the 2567 has not been finalized. A lot of allegations that were not true, and they looked at staffing sheets and every other thing and all the documentation we had. That's just somebody, I don't know what the purpose was. I would like to think it's constructive. We're waiting for our D&D survey. We're updating policies and procedures, their new standards from NIHO, which is our accrediting body's D&D NIHO standards. We're having a healthcare and screening September 6th. We have a lot of collaborative partners coming. We sent the LABCO report. I think that's come up a couple times. Michael and I had a Zoom meeting with, I believe his name is Gary Thompson. They will send a report probably mid-September. So that report ended up to be about 400 pages. And all of the issues that have been addressed previously, the 60-day plan, the strategic plan, what we've done over the years has gone in that report, everything that they asked for. Current activities, you know that we had a cyber attack, but also we changed the electronic health system. We're going in and trying to refine all the external reports that have to go to HI, other places that actually affected the delay of cost reports and some of the financial issues that have come up before. So we're trying to get that rectified for the future. They talked about the cyber attack. We had one in 2019. Department of Health called. They wanted additional information on that. We sent it. That one has been closed out. We're still working with IHP for incentive dollars. Last year, we probably achieved over, there was around $2 million not operating income that came from incentive dollars. And I'd like to point out that when you have operating income coming in, you have to have patients in bed, you have to have surgeries. It's not only the COVID, we brought up all of the decline in revenue for various reasons. The managed care arena where you have a lot of the write-offs. I'm sorry that people don't understand what contractual write-offs are. For Medicaid, it's going to get worse. You have in Congress all of the issues that are coming up with the Medicaid cuts, Medicare cuts possibly, disproportionate share, everything that has kept this hospital going for a long time. I think it's miraculous that it's here still. In January of 24, when we had an interim CFO, he alerted everybody that we were going into the $8.5 million that we budgeted for. The only person in this group that started a financial committee was Carmela. It went through different board presidents who did not react. I recognize Mrs. Colt wants to blame me, but take a look at your board and who was here before. Okay? I'm tired of the personal attacks. If you want to, we brought forward financial agreements. We have cut staff, some of which were supposed to be people that we salvaged over the years, or they were on the favorite list. I can tell you that there are board members, a board member that came in with a hit list. Okay, a hit list for employees because they didn't walk down the hall the way that they were supposed to walk down the hall. Okay? I am the one that finalized furloughs, etc., and we did it with the future of the hospital in mind. We salvaged people that knew med-surg. We salvaged people that could also do infection control. We moved people from med-surg to ED to keep the services open. We addressed the clinic and put people in that knew what they were doing and could come back to a job on med-surg when we opened. That's how we made the decisions. I am the one that went to the Med-Exec committee and recommended Melody Bowman because she works med-surg, she helps us out in the clinic. And when it comes to the clinic, that crew that's working in there now picked up 6 months of work that hadn't been done by the crew that was there previously. So if anybody wants to attack somebody for the furloughs attacked me because I made the decision that if we open med surg again and we go with critical access, that I have the people to be able to pull and staff it. So they're working emergency room, they're working med surg, they're working infection control, they're helping collect revenue. IT is helping us get the information in place so that we can send these reports out that affected the delays in the cost report. As it came to OB, we were losing at that time $600,000 a year, and the doctor that was our main OB person was having personal problems and wasn't even working in the hospital. Okay, we had another person, and that went on for a long time. There was a lot of money being paid. We decided, and if you look at the literature, there are a lot of rural hospitals that closed OB. You cannot survive on 6 deliveries a month. Okay? So if we have been transparent, we brought it forward, we tried to do our best. And if I listened to every rumor about kickbacks out there and whatever, I wouldn't be able to come to work every day. But we have clean consciences, we've done our best. I walked into this kind of mess in 2013, and guess what? Some of the players were the same. So we have done a good job. We're taking the nurses from the college. They're brand new. We're working with them. We're trying to get them education. We stopped our Flex Ed program so we could get them ED courses, be safe in that area. And I'm looking forward to opening the swing beds and opening the critical access, continuing that part of it. Why? When I came in and I was interviewed, everybody was talking about the clinic that had been talked about way back to 207 that never got open. They were talking about critical access. Why? The reimbursement is better for hospitals. Okay, and you can't, and we have to go forward, and that's the way we're going forward. The clinic, we were trying to get out of the medical office building, which is about $22,000 a month. Everybody supported it. Yes, it's in the middle of COVID again. It got delayed for whatever reasons, but you know what? Our employees go there. There's a lot of people that go see Sylvia because they've known her for 22 years and they trust her. Okay, and that's a vital part. We would like to get it open 24 hours a day, at least 7 days a week. Why? So you can go there and not go to Intercare. We just got the IHP contract. We're trying to get the Blue Shield contract. The revenue was not allocated properly. That's why they're going back and doing the budget. Everybody wanted that clinic so we could move out of the medical office building, and that's 5 years ago. So if anybody has any questions about the operations other than mindless allegations that are being made, call me up. I will have coffee with you. I will have tea with you. I will sit down, answer your questions. People from the community have come in to ask me questions, have gotten the answers. We'll be transparent, but stop attacking when it's needless to attack.
Okay, any questions from the board regarding Ms. Anaya's report? Any questions?
I have a question.
Rosie, any questions regarding the? Ms. Hudson, do you have any questions regarding the report Ms. Anaya made?
I do have a question. If OB was closed because it was losing $600,000 a year, why is the clinic that is losing $600,000 a year?
I don't believe the clinic is losing $600,000 a year, Ms. Hudson. We said at the last meeting, some of the revenue hadn't been allocated appropriately, and that's what they're doing. Plus, we didn't have the IHP contract, which we just got in April, and we're working on the Blue Shield contract, and we talked to Michael and some of the business people. They're redoing that. I don't believe we're losing $800,000, okay? But let's wait to see until the numbers come in.
Well, the clinic's been open for some time. It'd be nice to see numbers.
Right, and we had some of the wrong people in place because somebody hired a manager that wasn't qualified, who wasn't doing the job. Let us go back and look at it, okay?
How about going into training those people?
Yeah, I know you don't like some of the people, but they're doing a good job.
This is not about personalities and whether anyone is liked. It's about whether they're capable of doing the job and whether the money being spent is worthwhile and being utilized properly.
Yeah,
Stop taking it so personally. Stop taking it so personally. Can you not be objective about this?
You know, the sidebars come in and they come in underground and we hear them and we know who's saying them. So I'm just saying my piece now for once.
Well, I'll say my piece in public if I have a piece.
I've gone through 3 different attorney groups. I appreciate what she's teaching us. She's been impartial, okay, and I'm sorry that people are taking it the wrong way, but we're all learning. And every time one of you comes up here, we try to accommodate a realistic, objective approach to what you're saying. Staff reports, we've learned that, yes, they're helpful, but we've learned when somebody like Leslie comes up and says, hey, this is hard to understand, we go back and we try to make it better because we know we talk in medical lease. And sometimes we have to get down and say, okay, we have to look at it a different way. But we've gone through 3 attorney groups, and I got to tell you that I'm learning a lot from this group. They've been supportive, and they're playing to a board of 5, not a board of 1.
Well, there's
Okay. Now we will open public comment.
Hi, this is Julie. Listen, I'm going to address you personally.
That's fine,
Mm-hmm. You forget that you're a guest in this town, even though you've been here 12 years. Do you realize I worked for you for 2 years before I even met you? Do you realize that I resigned on good terms? Do you realize there's been 3 employees that quit without notice on numerous occasions and you hired them back? You're getting kind of lackadaisical because you're opening your mouth and speaking loudly when community members hear you and it gets repeated back. So we're very aware of what you're doing. Also, part of your job is to communicate with the chief of staff, Dr. Salobi, anytime there's any physician complaints. To my knowledge, there is a very concerning complaint going on right now that is not being communicated with the chief of staff, and the public have a right to know about this physician. This is where we lose trust with the hospital. Palo Verde Hospital is a laughing joke to other hospitals. Do you understand that? If we go to Palm Springs, they laugh. The nurses are embarrassed. Your contract is month to month, and according to our bylaws, you should be evaluated every single month on what you're doing. And Carmela, you keep speaking about this progress we're making. I just got notification that we have 20 days of cash on hand. You want to talk about the clinic? Please explain to me how the clinic is making money when it was closed 8/1, 8/8, 8/15, and now we're up to 8/20. You saw 21, 15, 19, 17, 17, 14, 11, 17, 16, 9, and 13 patients in August. And we do not collect funds for all that. We don't even know because you don't provide us the reports. Another concerning factor I have is Dr. Brooks, Dr. Salobi, Dr. Lucero, Dr. Rodriguez, all of our local physicians, Dr. Arco, they have earned the title of doctor. They went to school, they passed their boards, they participated in the community, they have earned their title. It's concerning to me that the public keeps referring to Sylvia Herrera as Dr. Herrera, and she is not correcting it. She is a nurse practitioner, certified by the Board of Nursing. And the community is falsely informed, and many people that I have spoken to thought she's a doctor. That is very concerning.
Any more public comment?
Yes, I want to say something. Yes. Let me explain to you something before you say it.
My petition was somewhere,
My education from Mexico was accepted in the United States as a doctor. This is the reason because they told me doctor here. If they don't want to tell me doctor, it's fine with me. I went to medicine school in Mexico. I couldn't bring my transcripts to the United States because it was, for me, it was, I went to a scholarship in Mexico, and my school didn't accept to bring this transcript to the United States. But they accept my education. I can show you the papers. I can show you I took the papers to Miami, and they gave me the medical doctor education accepted in the United States. It's fine with me. If you want to say that I'm nothing, I am humble. I don't care. Okay? But I want to tell you that I'm making money for the clinic. You should know. You should know that whatever I do, all the labs, all the CTs, all the MRIs, all the outpatient treatments that is coming under my name is revenue for the hospital, not only the visits. Okay? In another hospitals, they take that as a revenue. Nurse practitioner so-and-so is making this amount of money. Okay? If the center knows how much money I make, you should know.
Thank you, Doctor.
Any more public comments?
Since it got to that point, I need to correction. It's a violation of Medical Practice Act to either not correct people who call you a doctor to say another doctor, a nurse practitioner could be as good or better than doctor. But you need to correct them and say another doctor, a nurse practitioner. If you don't do that, that's violation of Medical Practice Act. Medical Board of California can arrest you for that. Number one. Number two is the discussion got to a point of referral. Well, let me finish that. First of all, Dr. Pedino, he was, I recommended to bring Sylvia and put him in clinic. And he said, Dr. Solveig, she needs years of practice in my office before she can even see a patient. I cannot let her go see a patient on her own. That's Dr. Pedino. God bless him. But on top of that, you are talking about referral and supporting the hospital. That's baloney. Talk is cheap. Show me the numbers. We have Dr. Solveig, Dr. Arco, and Dr. Spector that could see the patient in my clinic, my office, with good patients. You guys go talk to Elba Salman. She's my office manager. Most of you know her. Sylvia Herrera sent us maybe 2 patients in a year. She did not support this hospital. Only because she was trying to get more money from me for her office. She had a confrontational situation with me. She had a lawsuit against me. She didn't send it. But even before that, she didn't send much. We got more patients by Dr. Rahimi in 6 months of the first 6 months of this year than we got by Sylvia in the last 5 years. Okay? So if she wanted to support the hospital, the first thing she should have done is support the hospital. She did not. She did not support. She put her personal agenda ahead of them. One thing I can say, I wish I could say the same about Carmelo Rosen, but one thing I can say, Miss Anaya, she doesn't put her personal agenda ahead. So maybe you guys should learn. If you want a hospital that's prosperous, you need to have a clinic. That was why we supported the clinic. That's why we said build the clinic. The clinic, everybody knows in this town. And I supported that from 27 years ago when I say primary care doctor make decision what to do with their patient in the ER. Why? Because the primary care doctor are the lifeline of this hospital. And we've lost many primary care doctors, SAG, Inner Care, and Sylvia. She doesn't send patients to hospital. So you want to help the hospital? You should have helped the hospital in the last 2-3 years, which you didn't. The numbers are there. I waived my right. Anybody from the hospital, anybody from Sylvia's friend can go to my office and ask how many patients she referred. Did you read that? You okay with it? Did you read that? You can now listen. Okay. All right. How many patients did she refer to? Dr. Spector, Dr. Arthur, or myself? It's a number. You can't fool the numbers. You can just talk.
Okay. Any more public comment regarding the CEO report?
Hi, okay, so I'm a patient of Dr. Sylvia now, and when Dr. Sylvia was practicing, I needed some surgery done, and she asked me if I wanted to go to Dr. Shalobi. I said no, because he has horrible bedside manner, and, you know, so yes, and me, speaking for myself, you know, yes, she does. And even for my daughter, she gave her the option, do you want to go to Shalobi? And just not too long ago, she referred me to Dr. Arco, which I, you know, unfortunately because of the situation, I couldn't have my surgery done. But, you know, I just wanted to speak on that.
Okay, any more public comment?
Ma'am, can I get your full name?
Elizabeth Rojas.
Thank you.
Okay, no more public comment, close public comment. Any comments from the board? Dr. Brooks? No. Ms. Rao? No. Ms. Hudson? Okay, seeing none. Next item on the agenda, Medical Executive Committee Report.
Thank you. First item on the agenda, we had the CEO report. We had the MEC meeting yesterday. In-person participant was myself, Dr. Bowen, and remote was Dr. Arthur. Dr. Brooks was a guest of honor, as he's been on MEC and medical staff before, and we also like him to understand the issue before it comes to a board so we can discuss it with you in closed session. We received the management report as stated by Ms. Anaya. And we, under the committee report, we had a quality performance improvement committee summary for the emergency room. I'm sorry, I participated in that meeting, actually, the committee meeting, quality performance improvement committee. And I was there, of course, late, but that report was transmitted to the MEC. There was on the old business, I want to discuss this very briefly. Rosie, I have full confidence in your daughter. I have no quarrel with your daughter. I respect him, I trust him, I like him, I love him. Good. That wasn't the issue. When I talked to you, if you go back and look at and listen to the recorded speech, I said, are you afraid of making the right decision for this hospital and this board because you think your daughters are going to lose their job? That's what I said. I did not say you can go back, look at it. I will play for you next time. I did not say that they don't deserve it. I am the one who advocated and got the rest of the medical staff to approve your daughter to be the infectious disease control nurse based on Ms. Hudson and Ms. Anaya's recommendation. I have no problem with that. I think she was a perfect person for that. I don't think she is corrupt. I don't think your daughters are corrupt at all. I don't think you're corrupt, Rosie. I just think you're misguided, naive, and you follow the lead of somebody like this attorney and take the hospital down with it. That's all. So that's the 2 cents, and I'm sorry I took that time under NEC. New business, we discussed the emergency department manual. We reviewed it, and it's not on your agenda to approve it right now. However, because DND may come and inspect us at any time, we passed that. We have it ready just in case, and hopefully the board can have another meeting soon to approve it, or DND should be okay with that. Now, under new business also, we had a long discussion, as Carmelo mentioned it. The issue came up in the last meeting. A simple resolution of that would have been saving us $10,000 from attorney's fee, but we wasted it. The issue came Premier ER contract. And that Premier ER contract was on the closed session, and it was under trade secret. I mentioned it frankly to remove it and put it on open session. You could have just moved it to open session and done with it, but you didn't. Instead, you fought me, you argued with me. Then a week later, I get a letter from Joanna that says, that says, hello, Dr. Sullivan. We have obtained approval from a single corporate shareholder of Premier Health Group, Dr. Cardillo, to publicly disclose the agreement that was approved on July the 30th during the closed session. Dr. Cardillo has no right to dictate to this community what he wants to be in open session or in closed session. He has no right. He's making $4,800 every 24 hours, or $7,800 every 2 hours. We don't know where it is because we have no rules, but he has no right to tell us, just like the contract you give me. I have no right to tell you that this is confidential. You can't disclose it to the public unless I say. Every member of this committee should know how much I get paid right now. They should know how much Melody Bowman gets paid. They should know how much Sandy Anaya gets paid. They should know how much the attorney gets paid. Have you guys done that report? I mean, I've never seen the attorney report to say how much we spend money on attorneys. Not even 1 month. But that simple issue ended up in MEC because this was a significant issue. You violated medical staff bylaw. And I specifically asked Rosie and said, is this exclusive contract? And you can go back and look at the video. You shake your hand like no. But then the attorney jumped in and she wouldn't let you talk. She wouldn't even let you talk. She says, no, we don't have to let you back up. But that was an exclusive contract. And according to the bylaw, you should have taken it to the medical staff first. But why is it important? Why is it important is what the MEC has prepared and we're ready, to bring it down to everybody's attention. First of all, I'm sorry, and then today, 20 minutes before, I get a letter from Carmela, email, that we have obtained approval from a single corporate shareholder from me. I'm sorry, that was Joanne. She says, I'm responding to your letter received by the board. And then it says, Dr. Cardillo agreed to publish the agreement. And this letter came only an hour before the board meeting. Dr. Cardillo has no authority, responsibility, or power to decide whether or not that contract goes to the public or not. It's the board who makes that decision, not that attorney, the board. But you guys decided to go closed session and approve it. Now, what are the issues? I'm going to go over the issues that we discussed in MEC, and I will hand you the letter that came after the results of that. On page 4 of that contract, it says, this is a premier contract, it says appointment. Well, let me ask you, Carmela, who is the medical director of the premier group, do you know? Who's the premier medical director?
This is your time.
Say it again?
This is your time.
Oh, I know, but do you know who the medical director is?
This is your time.
I know, I'm using my
No,
you don't know
I'm not
who
going to answer.
Okay. See, this is why the public is upset. It's simple. If you know, you said it. You say Dr. Scargillo is medical group, Dr. McAfee is, Dr. Brooks is, Dr. Foley. You can't even answer a simple question. That who is the director of this group? Because the people who go to that ER may want to know who the director is to go complain about the ER, but they don't know because you're not willing to say it. But I'll read it to you. I'll read you page 4. You should have known. Why you should have known? Because it's page 4, item 1.4, medical director 8. Appointment. Within 10 days thereof, group shall nominate a physician for medical centers approval as medical director of emergency department. You haven't nominated anybody. So you already breached that contract. The 10 days is past. You haven't nominated anybody. And you don't even know who it is, even if you have nominated. All right? This is section, page 5, section 1.4 B, VIR 7. Attend, this is the job of the ER doctor. Attend meet, director, job of the ER director. Attend meeting of the medical center's medical staff. Has never happened. None of them have ever attended a single meeting. Then under qualification, on the page 5, on item 1.5, this is the direct violation of medical staff bylaw. Under 1.5 qualification, Each group physician shall be a member in good standing in the active staff category of medical staff. Rosie, do you know what active staff is? Do you know what active staff member is? Dr. Bush, do you know what active staff member is? What qualifies a doctor to be an active staff? You don't know. All right. Sandy, do you know what active staff is? I think not.
The bylaws say.
All right. Well, the bylaw is very specific. Active staff should be a physician who lives in this town and has office in this town. It may be waived only by the medical staff. That's very clear. Yes, it's in the bylaw. But in this contract, it puts all the ER by the active staff when they're not. They're consulting. So that's why you should bring this to medical staff, so we can teach you, help you to say what is active staff, so you don't violate the bylaw. Now you're going to spend another $10,000 for attorney to go through all 90 issues and try to fix it. Now item 1.11, medical staff membership and or clinical privilege of the group physician at the medical center shall be deemed resigned concurrently with the expiration or termination of this agreement. So this contract basically says, somebody like Dr. Arco, if you cancel the contract with this group, Dr. Arco loses his contract. Why? Or other doctors who work in there and want to work there, you cancel their contract, then you cancel their medical staff membership. What if Premier doesn't provide the doctors tomorrow, and you have no contract, they cancel their contract, and then what do? You close up the ER because you don't have a doctor. It was simple. You could have waived that, say only if in emergency we could keep those doctors. But you didn't. A simple way to save a hospital thousands of dollars so we don't have to go local tenants and legal fee, but you didn't. Exclusivity. I asked again, is this exclusive contract? And the attorney didn't say yes. Rosie at least was no or unsure. Section 2.3, exclusivity. There is a section, exclusivity. Medical centers shall not contract with any other physician or entities for professional services to be provided by the group under this agreement. Why? If Dr. Cardillo tomorrow gets an accident and he is not able to handle the hospital ER, we can go hire another doctor to cover the ER? Why? Why can't we? These are the problems that we have with this contract. But you weren't willing to listen. Thousands of dollars now. Leno is going to charge you, trust me. And section 4.10, again, same thing. It says even if the group, not Dr. Cardillo, does not have a contract with that doctor that says your privileges will expire if the contract expires. Even though there is no such contract, that physician loses his privileges. Why? It's unnecessary to tie your hand as a board, as a hospital CEO, tie your hand to the hand of a group that needs $700-800 every 24 hours. Now, under 17, page 17, 7.19, trade secret. Again, that's another line that the attorney told you. It's under trade secret. No, the trade secret is right there in the contract. And the trade secret is not for you guys. Trade secret means you guys, just like what she babbled about all the other ones after 2 years she's speaking on the other ones. Trade secret is like if you want to buy the building next to the hospital, you don't want anybody to know because somebody go buy it, so you have to pay higher. That's trade secret. Trade secret is not for the guy that you pay him $700-800 every 24 hours. So he has access to your trade secret. But read this. It's baffling. It says, during the term of this agreement, group means Dr. Cardillo Group, may have access and become acquainted with confidential information and trade secrets of the medical center. So you're letting him and his group find about your trade secret. Not that there is a trade secret that is beneficial to you. You're allowing a third party, somebody else, know about your trade secret. Why? It's just baffling. Now, I'll go to Exhibit D stipend. Exhibit D stipend. It says, Well, I'll skip that part of it. It says that the hospital will pay fixed operational costs. The hospital will pay fixed operational costs. What are fixed operational costs? Physician hourly salaries, medical director fee. Dr. Bush, do you know how much the medical director fee is for this ER group? Do you know? You don't know. Rosie, do you know? I don't know. Nobody knows. But I know how much it was a year ago when I came across it. It took me over a year to find out as a chief of staff. I kept hearing that the medical director makes a lot of money. I said, we don't have a medical director. We never approved the physician for medical director. I asked Trina. Trina tried to get that information. It took her 6 months, and finally she said, I'm trying now. And she said, Dr. X is worth $7,800 every 24 hours. I said, no, if you have the money, put Dr. X on for every 24 hours, but you don't have the money. You need to be financially, fiscally responsible. But how much are they getting paid? Didn't know. It wasn't until Sandy Hudson got on the board, or got whatever, she got involved, and I asked her, even that took 3 months. And Sandy can tell you who she got it from, but she finally got the numbers. We have a physician, Dr. McAfee, who got paid $10,000 a month to be the medical director of the group. $10,000 a month. On top of the $4,800 a day or $7,800, whatever else she got, on top of it. And I managed the ER scheduling for 10 years, never got paid a dime, never asked for a dime. Because it wasn't a big deal. Now she did some other stuff. But she got paid $10,000 a month. And I said, okay, where is that we approved her as a medical director? It's not. Well, in the contract it said she should be approved. It's not. So finally Sandy talked to Dr. Carpillo. They realized that it's violation of the contract. They took that off. So we saved the hospital $10,000 a month. But I couldn't convince you guys to ask him to pay back all the other money that he got paid. One, because he got it paid against the contract. That wasn't by the contract. But I'm not stingy. We save the hospital money, that's okay. So that's the problem with this contract. You have no number in front of medical director fee. If Dr. Cardillo charges you $100,000 a month right now, you have no legal basis to say you don't pay it. You don't. There's nowhere in this that limits you. Nowhere. That's the type of contract you guys approved in the last 4 years. Now, there is a medical malpractice fee and billing fee. Medical malpractice fee, we don't know how much it is. If malpractice fee goes up or down, you have to pay for it. That's something that I understand you may or may not have a choice. But if it was me, I would put a number to it. I would say no more than $10,000 a month, for example. But you don't. Billing fee, there is a percentage, I believe it's 5%, and administrative fee, 10%. On top of all this money that they make, they take 10% of your collection. So if you collect $200,000 a month, you pay $20,000 a month as administrative fee to making the schedule to leave the doctor's office. Now, what I argued with you guys for a long time, and I believe this is why this was in closed session, because you were ashamed to say that you knew about this. I discussed it with you over a year ago. I said, you can put a medical director fee. This should have been crossed out of that, but it's in there. I said also, you can't have a contract. How many of you give a contract to your landscaper or plumber to say, you can come fix this for $4,800 or $7,800. Nobody would accept that. The plumber would charge you $7,800 if you give him between $4,800 to $7,800. But it's on the contract. But now it says, now who decides it's $4,800 or $7,800 or range in between? It says, as determined by the medical director. Who is the medical director? We don't have him, we don't know. Who is the medical director? The same person who writes the check for herself or himself. She or he decides who gets $7,800. Ridiculous. And Palo Verde District Board, did you guys ever, in the last 10 years, ever, one of you voted to give Dr. X $4,800, Dr. Y $7,800 This never came to the board. You guys didn't even know that. It was never on the agenda in the last 10 years. This is in the contract, but you have no control over it. And CEO, remember, it doesn't say or, it says medical director and the board and the CEO for each individual physician. That means you three, the board, the CEO, and the medical director, should all three agree who gets paid $4,800 every 24 hours, who gets $5,000, who gets $6,000, who gets $7,800. None of this happened. So you've been violating this contract, and now you renew it to violate it again. Okay? So what happened? We went through this contract, and we had an extensive discussion what to do. And Dr. Bush can talk to you in full session about this. Well, before I forget, we also had the NEC. This was a peer review also. We reviewed a couple of physicians and radiology, and we have not made any decision. The NEC was NEC/peer review, even though it is not said that at the time. So, what is the final results? Okay. Just a point, Carmelo, you mentioned that Dr. Cardillo agreed to publish this agreement because there was a confidentiality provision in this agreement. You're wrong, Carmelo, once again. Because you didn't read it. That email was drafted, I bet you $1 million. That was drafted by the attorney you just sent it. Okay? You think the confidentiality is what prevented it. But on the agenda, on your own agenda, you approve, and you as a board chair, you run a meeting. Well, actually, you didn't run the meeting. The attorney ran the meeting, and you approve that agenda. The contract for Premier is under trade secret. You said it was in the closed session because it's a trade secret. You remember that closed secret? Okay. Now, the letter comes out. She says, Dr. Cardillo, although there was a confidentiality provision in the agreement, and Dr. Cardillo agreed to publish it. Again, Dr. Cardillo has no right to confidentiality, but I'll read you the confidentiality clause of that agreement. You'll be laughing. 7.6, Premier contract, confidentiality. It says, under this confidentiality, 7.6a, it says, group, I don't read the first part, I read in the middle. Group shall not disclose the terms of this agreement to any person who is not party or signatory to this agreement unless disclosed thereof is required by the law. So this disclosure agreement and confidentiality was not to limit us to release it, to limit this board to release it. It was to limit Dr. Cardillo and his group to release it. But either way, it's ridiculous anyways. You should have removed it. There's nothing confidential. This is a hospital that is a district hospital. There should be no clause of confidentiality. I went to court with it, and that was it. It's very clear. This is a district hospital. Even if you put 600 confidentiality clause, even if you put in there, you told you have to pay $5 million, you won't pay it, government. Because you cannot restrain the public from knowing what is financial contracts that you are doing. So this confidential contract prevents the Dr. Cardillo and group to talk about it, not you. But Carmela knew that the problem is that she violated the medical staff bylaw. This was an exclusive contract, so she followed the attorney's lead again, and she said it was a confidential contract. Now, we'll see how the letter comes next week to change it, if it's confidential or not. So based on that all said, the medical staff voted unanimously to write you a notice. This notice is, if you don't follow it, we'll go to court. In 10 days, we'll be in court. You pay your attorneys, and you pay our attorneys, both. According to medical staff bylaw, you pay up to $200,000 a year our attorneys. I don't want a single dollar to go to her, let alone go to our attorney. Resolve it before it gets to be a problem. Okay? So the letter reads, pursuant to the Palo Verde Hospital medical staff bylaw, as last ratified by Palo Verde Healthcare District Board on January 25, 2003, any exclusive contract arrangement for physician and or professional services must be presented to the medical staff at least 6 months prior to any decision being made. Not to bring it down after you approve it. You take your approval away. You can pay whatever it is. But this is section 14.3 of medical staff bylaw. Read it. I said, at the July 30, 2025 board meeting, during public comment, I specifically asked whether emergency department physician, professional service, and eventual directorship agreement, premier agreement, was an exclusive contract. Director Rosie Rao appeared to indicate no by shaking her head, until the attorney intervened and directed her to be silent, to remain silent, which she complied with. I advised the board that if this contract was in fact exclusive, it must be considered in open session, not in closed session, and referred to the medical staff for review under section 14.3. Despite the warning, the board proceeded to review and approve the premier agreement in closed session. I filed an official complaint for violation of Brown Act law right after the meeting. On August 15, the agreement was provided to me by email by Joanna. Upon review, it's clear that the premier agreement is indeed an exclusive contract as confirmed in section 2.3. By approving the premier contract in this manner, Palo Verde Healthcare District Board violated medical staff bylaw, which the board itself ratified. In addition, several provisions of the agreement directly conflicts with the bylaw, therefore requires revision before lawful implementation. I review most of it, not all of it. At its recent meeting yesterday, the Medical Executive Committee reviewed the premier agreement and determined that the corrective action is required. Accordingly, the NEC hereby requests that Palo Verde Healthcare District Board, number 1, formally, not say I sent it to you through email, formally present it means you want the medical staff to approve it, it has to go to Ms. Anaya. Ms. Anaya comes to the NEC meeting, she presents it to us. Present the premier agreement by the NEC within 10 days of receipt of this letter, pursuant to section 14.3 of the bylaw. Number 2, allow the NEC to review the agreement, propose revision to ensure compliance with the bylaws, and thereafter return a final version to the board for approval. If the board fails to honor this 10 days notice and continues to disregard the bylaws, the NEC will seek judicial intervention to enforce compliance. As set forth in section 14.1-3, the bylaws, the NEC is entitled to recover an attorney fee in connection with